So for today, we're going to discuss two common IV nutrition therapy or IV cocktail. So here are they. Okay, so the first would be the Myers cocktail, the yellow one, and the second that I'll be discussing later would be the glutathione. Okay, so let me start with Myers cocktail. Okay, so Myers cocktail was actually invented, of course, by Dr. Myers during the 1980s. Okay, so the main component, of course, would be magnesium. Okay, so magnesium, the main effect for our body is to relax the muscle. Okay, so one thing that you want to consider when you're having this therapy, one potential side effect, of course, would be the increased body heat. Okay, but one thing that you want to know with magnesium is since it relaxes the muscles, so for any athletes out there, okay, so this would be very important for you, or it would be nice to add in your daily regimen, especially after any training or any event that you went into. So after that day, it would support in your muscle relaxation or regeneration. Okay, now the reason why it is yellow, it's because of the B complex that is present here from B3, B6, B12, okay, cobalamin. So what are the purpose of this B complex? Okay? So we know that B complex is actually present in most of the enzyme activities in our body. Okay, so the purpose of this enzyme, of course, aside from providing the nutrients that we need for growth, relaxation, of course, it also helps in the nutritional support of our organ system. Okay, so the most common thing that you want to consider with having a Myers cocktail, since it has magnesium, okay, it also have one essential factors, okay, or nutrients, we call it Dexpanthenol. Okay, so that is a very, very deep medical term. So what I want you to understand with Dexpanthenol, it is one of the precursor in creating acetylcholine in our brain or in our nervous system. Now, the purpose of acetylcholine, it is a neurotransmitter. It's either increases our motor neuron or relaxes it. So knowing that, okay, now if you're having fatigue or what we call chronic fatigue, okay, let's say you've been working for a long time, you've been stressed, or for other patient of mine who are depressed, okay, acetylcholine is something that would help or benefit them. Okay, so having an IV drip, okay, with this Myers cocktail would increase, okay, the amount of acetylcholine inside our body. Okay, now aside from that, since we know that acetylcholine boosts, okay, our neurotransmitter, so for patients who are suffering from headaches such as migraine, okay, this would benefit also you. Okay, and also for patients who are suffering from depression, okay, this could be beneficial. Of course, I'm not saying this is a treatment, but what I'm saying is this could support in your improvement, okay, for improvement of the quality of your life. For the second IV nutrition that I want to discuss is the most popular, glutathione. Okay, so for the longest time, we know that glutathione has been only known to lighten skin or whiten skin, okay? But that is the old belief. Okay, now glutathione, as we know, is also important in our what we call in medicine the phase 1 and phase 2 detoxification of our liver. Okay, now let me explain further. One thing that you want to understand is glutathione is also produced by our body naturally. So the liver could produce it, the skin, the spleen, or any important organ system, especially the brain, could produce our own glutathione, because the main goal of glutathione is to detoxify. Okay, now when we say detoxify, okay, it's as simple as a magnet. Okay, now the goal when you put this IV directly into your vein with a specific dose, okay, or milligrams, okay, what it will do when it goes into your bloodstream is to technically absorb whatever toxin inside your body. For example, I have been working for a month now, okay, late at night, and aside from that, I've been eating unhealthy food, okay, fast food, preserved food. We call that the SAD diet, okay, or the standard American diet. Of course, with that lifestyle or habit, it would increase the stress load in my body. Now, an increase in the stress load inside my body would increase what we call the inflammatory reaction. Now, any form of inflammation, there would be cell destruction. And any form of cell destruction plus the food that I'm eating, plus the late night sleep that I'm doing would increase toxins. Okay? Now, this toxin has to be removed by our body. Now, of course, the liver, the gut, okay, or even the spleen or the kidney would produce its natural glutathione. But if there would be continuous abuse in our body, sometimes we need that supplement. Okay? And that supplement, this IV glutathione, what it would do is would increase the blood circulation of this glutathione and would increase the removal of these toxins. But one thing that I want you to remember before having this, make sure you have a good detoxification inside your body. It means that your liver and your kidney should be well functional. That's why you have to go directly to your trusted healthcare practitioner. Why? Because remember, any form of toxin has to be removed by the body, either through the urine or through the feces. And these are processed by the liver and the kidney. So if you have poor detoxification system inside your body, let's say your liver is, or let's say you're suffering from fatty liver, okay? Or let's say you have some acute problem with your kidney. Even if you put a lot of glutathione and your body cannot remove the toxins that have been neutralized by this nutritional therapy, it would continuously circulate inside you, and that would add in a lot of different problems. Okay, so that's one thing that you want to consider with IV nutrition. Okay, now one thing that I want also to add with this too. Okay, maybe one question: should I go for Myers first or glutathione first, or could I have both? Okay, now actually it would depend on to your partner doctor. So the first thing that normally they would do is they would have you have Myers cocktail, because the nutrients and the vitamins here would support in terms of increasing that removal of toxin or the formation of enzyme or anything that the body needs to repair your body. Okay, and then after a while you could have the second IV drip, which is glutathione, that would support into your removal of your toxin inside your body. That's why after the IV nutrition, sometimes most of my patients would go directly to the bathroom to urinate, which is a good thing. Okay, now aside from that, is what you want to consider after this is you have to drink a lot of water. Okay, because whatever you put into your body, okay, you have to remove it out as fast as you can. Okay, now there's one thing that you want to consider, or a common question by my patient is, do I have to take oral capsule after having an IV, or is it okay to just have an IV? Okay, now one thing that I want you to consider is an IV, since it would increase the amount of level or the concentration into your bloodstream, it would be easily removed, okay, by your body. Maybe in 24 to 48 hours, most of the IV nutrient would be removed immediately by your body, okay, or it would be used up already. Now, my suggestion, of course, is you have to have an oral supplement. Okay, for days that you won't be able to go to the clinic or the wellness spa, at least you would have something to support, okay, the lifestyle that you're having. But again, the most important thing that you want to consider, okay, with any form of IV nutrition, okay, like I always say to my client, to my patient, is you cannot out supplement a bad diet or a bad lifestyle. Okay, even if we continue to give this form of supplement, or no matter how good the IV nutrition that you're taking in, the most common problem, okay, which is the root cause normally, is the bad diet, the lifestyle. If those things won't be improved, okay, or to be reversed somehow, or somehow rebalance it, okay, then it would be hard for your body to recover. Because at the end of the day, the main goal of this IV nutrition supplement is to support you. It's not something to treat you, okay? It's not something that is used to replace, okay? The main goal is to support your body. So that is the reason why you have to have a healthcare practitioner working with you right now, okay?